Telling somebody that they have cancer is one of the hardest parts of my job. Fortunately, for a lot of cancers, there are things that you can do to catch them early. So keep watching because we're going to go over what you need to do to screen for the most common cancers in women. Hi, I'm Dr. Eric Richardson, a board-certified family practice physician. I'd like to welcome you to Family Med, a channel that focuses on giving you practical and accurate medical information to help you and your family. Well, in today's video, we're going to go over the most common recommended screening tests that you should be doing as a woman to catch cancer early. Well, cancer is a broad word that encompasses a lot of different types of problems, but the word is universal in its ability to cause fear and worry. We all likely have either had or known somebody who has had some sort of cancer. And I get asked frequently if I can just run a test to see if somebody has cancer. Unfortunately, no test like this exists, but there are certain cancers that are more common, and we found that certain tests can be helpful in catching those early. The first one that we're going to talk about is breast cancer. This is the most common cancer in women. In fact, there are over 266,000 women diagnosed with invasive breast cancer and over 40,000 deaths a year in the United States. But the good news is that we have found that early detection gives a woman the best chance to avoid dying from it. The screening method has been found to be most effective as a mammogram. There are varying recommendations that are given depending on what society you listen to, but for simplicity's sake in today's video, I'm going to go over the American Cancer Society's recommendations. But realize that there are some slight variations between different groups, so talk to your doctor about what's best for you. But overall, they recommend that women between 40 and 44 should be given the option to start screening with a mammogram every year. Between 45 and 55, they recommend getting one every year. Women 55 and older can switch to a mammogram every other year as long as they're otherwise healthy and expected to live at least 10 more years. If you have a very strong family history, meaning you have sisters or a mother with breast cancer, or you have other genetic tendencies or other issues that make you high risk, then you should talk to your doctor about other options, as some may benefit from getting a breast MRI instead. The next cancer we're going to talk about is cervical cancer. Over 13,000 people were diagnosed with invasive cervical cancer in 2018, with over 4,000 deaths. This is an easily preventable cancer with proper screening. Cervical cancer is caused by a sexually transmitted virus called the human papillomavirus. This is often referred to as HPV. The way we screen for cervical cancer is by performing a pap smear. This is where you take a brush and take some samples of cells from the cervix to make sure they're not cancerous. Now, how often you do this depends on your age. There are a few different recommendations, but most recommend that women start screening at age 21. From the age of 21 to 29, they recommend doing a pap smear every 3 years. Now, if you're between the age of 30 and 65, you have 3 options. You can do a pap smear every 3 years, or your doctor can do a pap and add a test for the HPV virus at the same time, which is good for 5 years. Or you can just test for the HPV virus every 5 years. Women over the age of 65 who had 3 consecutive negative pap smears with 2 consecutive HPV tests that have been negative should be able to stop screening. And those who have had a total hysterectomy for non-cancerous reasons don't need to be screened. There always can be some individual differences in recommendations, so make sure you talk to your doctor about what's right for you. The next one we're going to talk about is colon cancer. I've addressed this topic a little more in depth in a past video, so I'll put a link up here so you can dive into that a little more and learn about what options you have. But colon cancer can be deadly. It's estimated that over 140,000 people are diagnosed every year with it, and over 50,000 people die. The problem about colon cancer is that most often it doesn't have symptoms until it's much more advanced. The statistic that I just shared is good evidence of that. Out of the 140,000 people diagnosed with it, 1/3 are likely to die from it. That's why it's so important to do some sort of screening. When we make recommendations for screening for colon cancer, we need to divide people into risk categories. We divide patients into 2 categories, high risk and average risk. High risk patients are basically those who have certain genetic conditions and those with a strong family history. We consider a family history as a first-degree relative. That means your parents and siblings who have been diagnosed with colon cancer. If you fall into this category, then you should get a colonoscopy at least 10 years before when your family member was diagnosed with colon cancer, or the age of 45 to 50, whichever is earlier, depending on what guidelines you're following. If you find yourself in this category, then you need to be talking with your doctor about when and how you should be screened. Now, for those who are in average risk category, meaning everybody else who doesn't fit in the high risk category, newer recommendations have everybody starting to get screened at age 45. Other societies recommend age 50, so check with your doctor and your insurance company to see what's right for you and what they'll cover. Now, screening can include testing your stool for blood every year, doing a DNA test of your stool every 3 years, something called a CT colonography that you can do every 5 years, doing a flexible sigmoidoscopy where they examine the last half of your colon every 5 years, or getting a colonoscopy where they examine the entire colon every 10 years. All these tests are felt to be effective. There certainly are pros and cons of each, so talk with your doctor about what age is best for you and what type of test is going to be best. If you're over the age of 75 though, then you should have a discussion with your doctor about whether continued screening is going to be worthwhile. So basically, if you're between the age of 45 and 50 and older, or if you have a family history of colon cancer, you need to be asking your doctor about when and how they recommend you to be screened. One of the newer recommendations that has come out over the past few years is screening for lung cancer. Those who this applies to are current or prior smokers who've had at least a 30-pack year history of smoking. Now, what is a pack year, you may ask? Well, it's a term that we use to describe the cumulative amount of smoking that a person has done. So a 30-pack year history would be an average of a pack a day for 30 years. So if you're smoking 2 packs a day, if you do the math, then it only takes you 15 years to have the same smoking exposure, giving you a 30-pack year history. So if you smoke for that long and are currently smoking, or if you've quit within the past 15 years, you would fall in this category. Now, if you are in this category and you're otherwise healthy and in the age range of 55 to 74, then it's recommended that you have a discussion regarding the pros and cons of undergoing an annual low-dose CT scan once a year. So this is a fancy x-ray where you lay you on a table, run you through a scan to look for early evidence of changes of lung cancer. Now, this isn't for everybody, and it's not without its own risks, so you should discuss it with your doctor to see if it's appropriate for you. So, believe it or not, among all the cancers that are out there, those are the ones that we're able to do early screening for in women. The problem is that we don't have great tools to consistently and accurately go looking for them on everybody. So the best advice that I can give on catching other cancers early is pay attention to your body. If something's changing on you, if you don't feel right, if you have a pain or something else that isn't going away or getting worse, then go in and get it checked out. Cancer certainly is not a diagnosis that anybody wants to fight, nor is it a diagnosis that I look forward to giving. So by taking these steps to get appropriate screening and by paying attention to changes in your body, you can have the best chance of catching these cancers before they can cause a big problem. If you haven't already done them, get into your doctor now and get screened. Well, I really appreciate you watching today and hope that you found this to be helpful. If you did, make sure to give this video a like and share it with your friends. It does help our channel to grow and reach others that may need this in their life. Now, don't leave without subscribing either, and hit that notification button so you don't miss out on any of our future content. Well, it sure has been a pleasure sharing these few moments with you. I wish you well on your health journey, and I do hope to see you in the next video.